Hi, it's Dr. Tyler Kowalski with Kowalski Chiropractic, and today we're going to be talking about knees. So when we're talking about knees, first thing we'll do a good exam and evaluation if you're having any knee pain. We want to determine if it's an acute injury, a new injury, or if it's a chronic injury that kind of has slowly come over time and it's been something you're dealing with over time. When we're talking about chronic injuries, we're definitely going to be looking at the ankle and the hip. Sometimes if there's dysfunction in movement or anything like that, that's going to cause knee pain. If it's an acute injury, say you had a sports injury or a fall, or someone kind of ran into the knee, we're going to kind of evaluate that, make sure the knee itself is strong and stable and there's nothing more serious going on. So an example of that would be we check all the major ligaments. So you got these two major ligaments, the medial and lateral collateral ligaments that run right along the side here. And so if we're checking the medial one, we're just going to have the patient relax, add a little gentle pressure. We're looking for any pain or swelling on each side of these. Same thing, we'd kind of, if we're checking this ligament out here, we're going to add a little pressure. If that would cause any pain, that'd be something we'd look more into. We also want to check the ACL and the PCL, the two ligaments that run deep in the knee itself. So we're going to kind of bring the knee up just like this, stabilize the foot and ankle. We're just going to add a little downward pressure, looking for any transition or any pain elicited with that. And then same thing, we're going to kind of pull it up this way, and we're just seeing how that knee is moving. Want it nice, strong, and stable. If there's any pain with that, that would be another thing we'd look more into. And then you have your two meniscus ligaments that kind of act like two cushions that sit deep in the knee there. So we're going to check those here, have the patient kind of flex the knee up, and then we're just going to add some pressure as we turn the foot in and out, and then we kind of bring the knee around. We're kind of checking for any locking, any pain with that. There's a couple other ways we can check those, but this is just a few checks, checking all the main ligaments there. And then we'd also check the kneecap itself, if moving it around causes any pain. And that's kind of a quick exam, just checking all the main ligaments. Like I said, if there was any pain or any dysfunction with any of those kind of orthopedic tests, we may refer them on for some more imaging or refer them to an orthopedic doctor if we thought it was more serious. So, but that kind of cleared the patient of the big issues there with the knee. And then, like I said, if it's more of a chronic issue, we would check the hip and the ankle and make sure everything's functioning with those. Sometimes if there's any dysfunction in the hip and ankle, the knee kind of makes up for it and takes the stress, and that can lead to knee pain. So there's a quick example of a knee exam and evaluation, and then the next video I'll kind of show you some treatments we could do to help with knee pain.